The town of Coventry, Rhode Island presents the Coventry Substance Abuse Prevention Task Force video series. We're working together for a healthy community.
Hi everyone, thank you for being here today, and thank you to those who are watching this remotely. My name is Gyda, Gudmundsdottir, and I'm a school psychology intern at Coventry High School, and I also do rotations at the elementary and middle school levels. I am a PhD candidate at the University of Rhode Island in school psychology, and much of my research has been focused on misuse of prescription drugs. Prescription stimulants primarily intended for the treatment of attention deficit hyperactivity disorder, ADHD, and all of my research on that topic has been conducted within the college student population, but as we all know, college students all go to high school before they go to college, so it is possible or very likely that they're already engaging in some form of substance use before they start engaging in it at the college level. So there are several types of prescription stimulants that are available for the treatment of ADHD, including methylphenidate, Ritalin, as well as amphetamine-based drugs, including Adderall. And these medications are effective to treat ADHD, and they're safe when they're used medically, according to doctors' orders and advice. However, when they're used non-medically without a prescription, when they're taken through different routes of administration, including so not only orally, but when they're taken nasally or injected or even smoked, their potential for causing harm is significantly increased. And these medications can cause side effects that range from mild to severe, occasionally even death. So this is clearly a serious matter. And we have seen an increase in the misuse of prescription stimulants in recent years, along with the growing numbers of prescriptions of these drugs. So as we're prescribing more of these drugs, their misuse has also increased. So it seems that greater availability means the greater likelihood of misuse. And so a recent study, a meta-analysis that took together or examined the literature that is available out there on the prevalence of this behavior in the college population. They identified 20 studies that looked at the prevalence of prescription stimulant misuse behavior among college students, and found that the overall prevalence rate of this behavior was 17%. So 17% of our college students in the United States have engaged in this behavior at least once. And the primary motivation for this behavior appears to be academic and cognitive enhancement, so to be better able to study for exams, to power through, to pull an all-nighter, to do better on assignments, but we really don't know if these medications are effective at producing those effects, even if students perceive themselves as deriving benefits and being able to better perform while taking these drugs. We don't know if that's really occurring. It may be simply their perception without it necessarily being the reality. And other reasons include partying to get high, to extend the effects of other drugs, and to be able to stay awake longer to party and have fun. And this is not safe, so we clearly need to do more to try to curtail this behavior. So in the college population, the prevalence has been identified as 17%. In college, the numbers that I was able to identify indicate that between 6 and 7% of college students have used prescription stimulants, non-medically. Compared with, we were talking about prescription opioids earlier, that number is approximately 8%, so very similar numbers across those two classes of drugs. And the risk factors are important to identify if we want to engage in prevention and intervention. We would like to educate the entire student body about the dangers of misusing drugs, but we also want to identify the groups of students who are more likely than others to engage in this behavior, and then we of course want to intervene with the students who are already engaging in this behavior. So these three levels of risk: the universal, the targeted, and indicated levels of risk. And so students who are already engaging in misuse of prescription drugs or prescription stimulants are so the risk factors include being male, being Caucasian versus other races and ethnicities, students who have a lower GPA, who do more poorly academically, students who struggle with symptoms of depression, anxiety, and stress, students who have symptoms of ADHD, possibly untreated. So many of these students seem to be self-medicating. They seem to be treating some kind of issues that they have going on, psychosocial struggles, and so there are definitely groups out there who are more likely than others to try these medications to self-medicate. And also students who are impulsive, who are sensation-seeking, who are looking for the rush, who are experimenting and trying things out. So we definitely have the research literature out there is accumulating, and we can use those findings to create effective programs to prevent and intervene this behavior. And it also is important to note that one study that I found among high school students in grades 9 through 12 is that students who report non-medical use of prescription drugs in general, not only stimulants, but all prescription classes of prescription drugs, including pain relievers, stimulants, and depressants, were significantly more likely to report suicidal ideation than others. So clearly, as was mentioned before, this is a problem. It can be defined as a disease in many cases when people have abuse and addiction issues, really. So we have a lot of opportunities to reach out and support these individuals. All right, any questions?
The Coventry, Rhode Island Substance Abuse Prevention Task Force would like to thank the following speakers who have contributed to this video series. For additional information and guidance regarding substance abuse prevention and treatment, please contact the following resources.